Welcome to the Omni Dental Podcast. We are embarking on a a really crucial deep dive today. We're focusing on dental health specifically, why enamel erosion happens and how to prevent it. And if you think you already know the answer, brush more, avoid sugar, you might be surprised by the complexity.
Oh, absolutely.
And more importantly, the hidden sort of systemic causes that are attacking your teeth from the inside out.
That's so right. Our mission today is to give you a real shortcut to understanding this, to move beyond that surface level advice. I mean, enamel erosion is defined as the irreversible wear of your tooth structure.
Irreversible, that's the key word.
It is. It's caused by chemical action, specifically acids, and importantly, without bacteria being involved. This isn't decay.
It's a different process entirely.
A different beast. And it's a common issue that weakens teeth. It drastically increases sensitivity, and it just breaks down that protective layer. So if you want to maintain a healthy smile, understanding this is, well, it's essential.
And to guide us through all this detailed material, we are diving deep into the expertise and the sources provided by Omni Dental and MedSpa. They offer a really unique kind of integrated view of health and aesthetics, which makes them the perfect source for a problem like this.
Precisely.
Yeah.
Because it crosses disciplines. For context, Omni Dental and MedSpa is located in Arlington Heights, Illinois. They're at 305 E Rand Road.
Okay.
And it's a practice led by Dr. Billis Poles, DDS, who brings, over a decade of high-level experience to the table. What really stands out is his specialization in treating dental injuries and emergencies.
When you hear emergency dentist, it just signals a really high level of preparedness.
It does.
And precision. They have to be ready for the most complex, time-sensitive stuff.
Exactly, and that precision is foundational to their whole philosophy.
Yeah.
They focus on personalized treatment plans, using advanced tech to make appointments comfortable, stress-free. They really seem to emphasize excellence in care, whether it's a routine checkup or something much more complex.
So when we talk about their scope, it really shows that holistic perspective you mentioned. This is not just a standard dental office.
Not at all. On the dental side, they are comprehensive. You'll find everything from preventive care, cosmetic treatments like Invisalign, teeth whitening.
Things you'd expect.
Right. But then they also have the most advanced surgical and restorative procedures. We're talking dental implants, root canals, even bone grafting.
Wow.
But what makes them so unique is that aesthetic integration.
That's the MedSpa part of the name, right? Completing that picture of kind of head-to-toe wellness.
Exactly. They offer complementary aesthetic services like injectables, Botox, fillers, and advanced skin treatments, hydrofacials, microneedling.
So it's a whole person approach.
It is. Even body treatments like laser hair removal. It suggests they see oral health not in a vacuum, but as a critical part of a person's overall aesthetic and physical well-being.
And just to cover the full service area, for anyone listening in that vicinity, Omni Dental serves Arlington Heights and nearby communities. So Buffalo Grove, Palatine, Mount Prospect, Rolling Meadows.
Schaumburg, Wheeling, Des Plaines, and Elk Grove Village, too.
It's a pretty wide area.
It is. So that's the geographical context. Now, let's get to the core of the problem, this acid attack mechanism.
Okay, let's unpack this. We said enamel erosion is irreversible chemical wear. For the listener, what is actually happening when that enamel breaks down? How quickly can this really accelerate?
Well, think of tooth enamel as the strongest concrete wall you can imagine. It's the hardest substance in the human body.
Harder than bone.
Much harder. Its mineral structure is incredibly durable. But, and this is the catch, it's acutely sensitive to acid. So when the pH level in your mouth drops below a critical threshold, it's usually around 5.5.
5.5, okay.
The acids start to pull the minerals, primarily calcium and phosphate, right out of the enamel. That process is called demineralization.
So the acid isn't dissolving the tooth in the way you might think. It's leaching the protective minerals out.
Precisely. It softens the concrete, making it weaker, rougher, and way more susceptible to just physical wear from chewing or even brushing.
I see.
And if this acid exposure is frequent and prolonged, that enamel layer thins out until it exposes the dentin underneath. And that's when you get that sharp, often painful sensitivity.
I think the most straightforward cause, the one everyone sort of knows, is diet. We know citrus and soda are bad, but what's the nuance there? Is it the amount of acidic food, or is it the frequency of exposure that really matters most?
It's overwhelmingly the frequency and the duration. A single acidic event won't destroy your teeth.
Yeah.
But constantly bathing them in acid all day long, That doesn't give your mouth a chance to recover.
Ah.
Think about, constantly sipping on soda or energy drinks or even those flavored sparkling waters.
Which can be surprisingly acidic.
Very acidic. Or just habitually snacking on citrus fruits.
So we're talking lemons, limes, oranges, all the sodas, fruit juices, and even things people think are healthy, like a vinaigrette on a salad.
Yes. Or balsamic vinegar. Frequent wine consumption. And people often overlook things like chewing vitamin C supplements, which are highly acidic, or just holding a fizzy drink in your mouth before you swallow.
Anything that keeps that pH below 5.5 for a long time.
That's the killer right there.
Okay, but this is where it gets really, really interesting because the sources from Omni Dental highlighted that the most destructive acid can actually come from inside our own bodies. Let's talk about systemic health, like acid reflux and GERD.
This is critical knowledge. It really differentiates the type of damage we see.
Yeah.
Gastroesophageal reflux disease, or GERD, it's a chronic condition where stomach acid frequently flows back up into the esophagus.
And into the mouth?
And critically, yes, into the mouth. Now, stomach acid, hydrochloric acid, is far more corrosive than the citric acid in a lemon. Its pH can be as low as 1.5 to 2.0.
That is devastatingly strong. So what's the pattern of damage? How can a dentist look in a mouth and know that GER is the culprit, not diet?
That is the important diagnostic detail. See, dietary acid usually attacks the front surfaces of the teeth.
Where the food first hits.
Exactly, what dentists call the buccal surfaces. In contrast, the acid from GER, it typically pools at the back of the mouth. So it causes severe erosion on the biting surfaces and most notably on the tongue side of the back teeth. Lingual surfaces.
Oh, interesting.
So a dentist spotting erosion primarily in those posterior lingual areas will immediately suspect GERD and, refer the patient for medical management.
That's fascinating. It really shows how oral health is like a silent early warning system for what's happening inside.
It truly is.
And then even more destructive are the effects from certain eating disorders.
Yes, that is the most severe form of this internal acid damage. Eating disorders that involve frequent self-induced vomiting, like bulimia, expose the teeth to a high volume of that extremely corrosive stomach acid on a regular basis.
And that just accelerates the whole demineralization process.
So rapidly, it can destroy significant amounts of enamel and dentin in a very short period of time. The priority there, of course, involves both dental protection and specialized mental and physical health support.
So we've covered external dietary acid and internal systemic acid. What about the role of the mouth's natural environment, things like saliva and hygiene?
That brings us to the third category of causes, which is all about your body's defenses. First, saliva production. Saliva is your mouth's superhero.
Right?
It contains bicarbonate, which acts as a natural buffer. It neutralizes acids and brings the mouth's pH back up to a safe level and quickly.
So low saliva production dry mouth is basically like taking the buffer out of the system.
You got it. If you have low saliva, maybe from medications or aging or certain medical conditions, that acid attack just lingers for much, much longer. It dramatically increases the risk.
And saliva does more than just neutralize, right?
It does. It also acts as a reservoir for calcium and phosphate, the very minerals the enamel needs to repair itself. So without enough saliva, there's no immediate repair mechanism.
And finally, where does poor oral hygiene fit into this acid picture?
It plays its own role, but in a slightly different way. When you don't brush or floss regularly, plaque builds up. The bacteria in that plaque, they consume leftover sugars and carbs, and their waste products are acids.
Lactic acid.
Primarily lactic acid, yes. So while poor hygiene is the main cause of decay or cavities, those bacterial acids also contribute to the overall acidic environment that helps erosion along. It's a double whammy. You have external acid, internal acid, and now microbial acid all attacking that protective layer.
That paints a very clear and honestly a slightly terrifying picture of the forces working against our enamel.
It can be.
So what does this all mean for the person listening right now? We need some critical, actionable strategies to fight back.
Okay. We can synthesize the source material into 5 critical immediate action steps. The key is intervention and strengthening.
Let's start with managing the external acid exposure. Strategy 1.
Strategy 1 is limiting acidic intake, but with a critical twist. Yes, you need to reduce consumption of sodas, energy drinks, excessive citrus, but for those acidic things you do consume, you must follow the golden rule.
Which is?
Rinse immediately with plain water afterward. Don't wait. A simple water rinse helps neutralize that acid residue and just washes it away.
Okay, what about brushing? I think a lot of people feel the need to brush their teeth right after drinking, say, a glass of orange juice.
And that is the most crucial nuance of strategy 1. This detail makes all the difference. Never brush immediately after consuming acidic foods or drinks.
Really? That's so counterintuitive.
It is, but the acid temporarily softens the enamel. If you immediately go in there and brush, you are physically scrubbing away that softened, demineralized surface layer. You're accelerating the erosion.
So you have to wait.
You must wait at least 30 to 45 minutes. Give your saliva time to neutralize the acid and start that remineralization process before you brush.
That timing detail is a massive takeaway. Okay, strategy 2 focuses on strengthening.
Strategy 2 is to strengthen and remineralize using fluoride. Fluoride is the only substance that's proven to actively help repair the damage. When you use a fluoride toothpaste or mouthwash, the fluoride integrates into that softened enamel structure.
How does it work chemically?
Well, what's fascinating is that it chemically attracts calcium and phosphate ions from your saliva back into the tooth structure, and it forms a new crystal called fluorapatite.
Fluorapatite.
Yes, and fluorapatite is structurally harder and significantly more resistant to acid attack than your original enamel ever was.
Wow. So it builds it back stronger.
It does. A dentist might even recommend a prescriptive high fluoride toothpaste if erosion is already advanced.
So since we identified low saliva as a huge problem, strategy 3 must be about boosting those natural defenses.
Absolutely. Strategy 3, boost your natural defenses. Choose sugar-free gum, especially after an acidic meal or drink.
How does that help?
Chewing powerfully stimulates saliva production. It increases the flow of that alkaline, mineral-rich fluid, and this rapid increase in flow just shortens the duration of the acid attack. It minimizes that demineralization window.
Strategy 4 is the foundational, non-negotiable step, hygiene, but with a specific twist for vulnerable enamel.
Right. Maintain impeccable oral hygiene, but do it gently. Brush at least twice daily with a soft bristled toothbrush. The soft bristles are essential because if your enamel is already thin, aggressive brushing with a medium or hard brush will just cause mechanical wear and make it worse.
And flossing, of course.
And of course, flossing once a day. That removes the plaque from between the teeth and cuts down on those microbial acids.
And finally, strategy 5, the necessary professional oversight.
Strategy 5 is professional oversight. Regular dental visits are just non-negotiable for erosion, especially because the damage often happens on those hidden tongue-side surfaces we talked about with GRD.
Right, the places you can't see yourself?
Exactly. Your dentist helps catch the early signs, diagnoses the pattern, is it dietary, is it systemic, and can provide professional high-concentration fluoride treatments or even discuss protective measures like dental bonding or crowns if the damage is severe.
This has been incredibly insightful. It really reveals that protecting your smile involves this meticulous vigilance about diet, hygiene, and that critical recognition of underlying health issues. Things like GRAD or eating disorders that often require joint medical and dental care.
And we've provided you with the nuanced knowledge you need to not just protect your enamel, but to really understand the fundamental chemistry of your own oral environment.
That knowledge is your first and best defense.
It is. And as we conclude, here's a final thought for you to mull over. Since enamel erosion can stem from these profound systemic issues like GRA or eating disorders, issues deeply tied to your digestive and your mental health, what does that really tell you about the necessity of protecting your smile? Protecting your teeth is often a critical indicator, a sort of barometer of your deeper physical and psychological well-being.
A profound reminder that the mouth is truly the gateway to the body. And remember, if you are experiencing tooth sensitivity, discomfort, or pain, and you're in the Arlington Heights area or one of those nearby communities, Omni Dental and Med Spa is ready to assist with personalized and advanced care.
You can contact them directly at 847-483-8833.
Thank you for joining us for this deep dive into the silent erosion of your smile.